Today, we're getting under the hood of women's health with Dr. Melisa Holmes, the founder of Girlology and a fierce advocate for closing gaps in women's health by starting with girls' health. She is a board-certified OB-GYN with over 25 years' experience focused on pediatric and adolescent gynecology. Dr. Holmes is getting under the hood of adolescence.
So I've been practicing pediatric and adolescent gynecology for over 25 years. For the last 15 years of my career, it's been the sole focus of my practice. I started off doing general women's health and recognized that there were so many adult women who just didn't understand their body or how it worked. And I loved the energy and curiosity and even the attitudes of some of my adolescent patients. And I just realized that if I could help these younger people understand their bodies and be more comfortable talking about it, we could change the future of women's health. And so that's why I really pivoted my practice to focus on pediatric and adolescent gynecology. Well, historically, there have been two talks, right? There's the puberty talk, and then there's the sex talk, which typically includes, how babies are made, birth control, and sexually transmitted disease prevention. But there is so much more to talk about, especially if we want to help girls understand their emerging sexuality and their right to enjoying sex that is understood, wanted, pleasurable, and safe. I say that a lot because to me, that's the definition of being sex positive. And that's always kind of where I try to ground my conversations. And the other thing I'll say is that young people are so curious about sex and relationships, and they are desperate to have conversations with adults who talk to them with, feeling comfortable and without judgment, especially. Just because they're asking doesn't mean they're ready to go out and do it. They're all really curious. So, for me, the goal is we need to have multiple layered conversations. They can start as early as, kids are learning to name their body parts. And then with maturity, all those conversations are revisited with this layered complexity and detail. So a young, a toddler might understand where a baby comes from, but you'll add more content to that as they age. So whenever I'm talking to kids about sexual health, I always try to keep it positive, right? Like sex is should be fun, it should be safe, it should be wanted, it should be pleasurable. And I've learned through the years that I didn't always do it right. I've learned a lot from my patients, but I also just to keep it comfortable for everybody, I never make assumptions about anyone's sexual development or their sexuality. I don't presume they're having sex. I don't presume they're not having sex. I just try to approach it with curiosity. So I always start with the question, have you been romantically interested in anyone? And if they say yes, then I follow with, do you like boys, girls, both, or neither? And I love that question because a lot of them really appreciate being asked that. And for younger teens, the answer is often both. And it's such a normal answer developmentally. A lot of parents get worried or stressed out, but that answer is so typical of a 13 and 14-year-old, like, because girls love their girlfriends. And some of them are also getting interested in boys, and they're just not sure which one they love more. So, and then we just keep moving along. How many people have you had sex with? Anyone with a penis? If so, are you protecting yourself from infections? Or are you protecting yourself from pregnancy? So it's more like instead of assuming someone needs birth control, I want to ask them if they have that need or if they recognize that need. Um, so that's how I approach talking to kids in my office about sex. When I'm talking with kids in an educational setting, I approach it very differently, obviously, if you're doing this in a group setting. And that's where my three buckets come in, because if you talk about sex for reproduction, it's about how the male and female bodies work, how sperm gets to the egg, how we prevent that if we don't want pregnancy. So that's the mechanics. And that also leads to questions about sexual orientation and all the ways that families are formed through adoption, surrogacy, donor, sperm, egg, even choice. And it opens the door to talk about reproductive rights. I mean, so sex for reproduction is a big bucket. The second bucket is sex for fun, which means, it's not going to be fun if you end up with an unwanted pregnancy or a sexually transmitted infection. So those topics get covered. If it's fun, it also means it's going to be with consent and it's mutually pleasurable. So, and then that brings you to behaviors. So that brings you to healthy relationships and boundaries, and conversations about gender and attraction fit in nicely there. So, and sex is definitely not fun if people's rights are violated. So that also brings up abuse and harassment and assault. And then that third bucket is healthy relationships. And I mean, there's so much to talk about there, right? So learning negotiation skills and boundaries. So there's so much to talk about, that what I want people to know is that it's not a one and done conversation. It is multiple conversations that happen over a long period of time with trusted, resources. There are so many myths, but I think there are two that come up in my office all the time. One is that a lot of adolescents have bought into porn scripts. And it makes me, pornography is such a part of their life. It's in everyone's back pocket. Girls are looking at it at almost as often, not as often, but, as many girls have looked at it as boys. In my opinion, I think porn has really deprived young people of exploring what feels good without having these preconceived ideas of what sex is supposed to look like or sound like or be like. So that is one of the biggest myths that I think I see in my office. The other huge myth that we see in the office, and my co-founder, who is a pediatrician that works in college health, sees this all the time. They all think they would know if they had a sexually transmitted infection. And then they freeze when I explain that most males have no symptoms at all if they have gonorrhea or chlamydia, and only half of girls will have any symptoms if they have gonorrhea or chlamydia. And so if they're having sex, just get tested. There's no shame, there's no, stigma. Just go in to your doctor's office. We'll be so happy to do your test. And all we need is urine. Parents don't realize is that teens today are having less sex than their parents' generations did, and probably even their grandparents' generation, but they have higher rates of STIs because they're not using condoms as frequently or consistently. So that is one of those, the whole STI lack of knowledge is one of the big problems that I see. Consent is such a big topic. And it's important because for adolescents, 1 in 3 are going to experience emotional or physical abuse in a dating relationship. And when that pattern is established in the teenage years, it's a lot more common. It's more likely to be common as in their adult relationships. Giving them some autonomy over their body, we can start at very young ages, and that helps them understand that they are in control as they get into those teen years. It's just a part of that healthy communication and negotiation that you can learn at any age, but then apply it to, romantic relationships as they age. Also about showing care and concern for your partner. So it's not just talking them into a yes, or, nagging them until they finally say yes, but it's really having that dialogue, checking in to make sure they're still enjoying the activity, and showing that care and concern. And so consent has really blossomed into a much more robust conversation, I think, in the past probably 5 or 6 years. But the truth is, when I talk to young people about contraception, the best birth control for any teen is going to be the one that she trusts and she believes she can use correctly and consistently every time. For some, that's going to be a pill. For others, that is going to be one of those long acting contraceptives. And for some who aren't having sex very often and don't want to take hormones, it might be condoms, might be their best option. So we have to individualize it. There's no right answer for everyone, even for teenagers, even though we used to think we had the right answer. We don't. The conversation about STIs really varies just depending on my patients. I mean, a lot of girls are scared to death about having an STI. I've had some who come in and want to be tested and they haven't even had sex before. They're just so worried about STIs. And then I have others who are just completely nonchalant about them. And the main thing I want them to know is that usually there are no symptoms for the most common STIs. And so getting into your healthcare provider and getting tested is really the responsible thing to do. Kids want their parents more involved. And I think that parents need to step up and be ready to do that. And definitely there's some resources out there, but just recognizing that we want our kids to grow up and have a healthy sex life and be responsible partners, and giving them that education is crucial for that. So I think the biggest thing I tell parents is, what do you hope for her? And that's exactly what I ask teenagers too. When they say, like, how will I know when I'm ready to have sex? I turn that question around and I say, well, what do you want it to be like? Do you want it to be in a relationship that you feel safe and cared for? Do you want it to be in the backseat of a car when you're drunk? You know, and kids are great at talking through that answer. So I think if parents approach it in the same way, they'll do a better job of being honest and with themselves that their daughters are going to become sexually active, and helping them get to the point where they develop a healthy respect for their own sexuality. And again, making sure that they understand that their parents ultimately want them to have sex that is wanted and understood and safe and pleasurable, because that is what we really want, even though it's hard to say when it's our own daughter. We just have to be realistic about our dreams for them as adults. I have a teenager, and I know they all Google their questions and they search for answers on TikTok. My daughter does it too, or they go to their group of friends. And, although there are some doctors on social media platforms and their friends are great, I just don't want girls to trust those resources with their sexual health questions, because everyone's a little different. And, you need to talk to someone that has accurate knowledge. So for teens, I think following Girlology is a resource. We only put evidence-based, medically accurate content up there. It's all created by doctors. The As nerdy as it sounds, the Center for Disease Control actually has some great patient education information. And that's just cdc.gov. And you can use their little search box to look up almost any topic that has to do with sexual health. And then the other resource that is my favorite, and I know provides very accurate, evidence-based information, is bedsider.org, which has mostly information about birth control, but also covers a lot of sexual health. So for my adolescent female patients, my advice is to remind you that you are the expert on your own body. And if you're not paying attention to your body and your health, nobody else will either. Your teenage years are the years when you establish the most important health habits that you'll carry through the rest of your life. So if you can get in the habit of paying attention to your body and taking care of it and understanding how it works, then you are going to create a lifetime of better health.